Charlie Angus is the NDP ethics critic and the critic for Indigenous youth, and Jack Hicks is a suicide prevention expert. As you can see, they're both with me in the studio. Good to see you, gentlemen. Thanks for being here. Charlie, let me start with you. What does your motion call for?
The motion 174 calls to put in place a national suicide prevention action plan that the federal government actually plays a part at the table. There are so many gaps in the issue of suicide prevention that's not being addressed at the federal level. And I can tell you, in my day job as a member of parliament, I've been to too many funerals of young people. We've dealt with the suicide crisis in the far north. We saw the horrific deaths of the children in Wapakika. We were involved. And Jack came to me at one point and said, "Why is this nation not have a national strategy?" And that was the beginning of that whole process of realizing that we're dealing with deaths of young people, deaths with people across the economic and cultural spectrum, and yet the federal government has, pieces here, there, and everywhere, but no coherent strategy to respond.
Mr. Hicks, why don't we have a national strategy?
Well, that's a very good question. I think most Canadians would like to think that the government follows World Health Organization recommendations, and I'm sure we follow most of them, but for some reason we are one of the very few developed countries, I'm only aware of the Netherlands as the other, that doesn't have a national strategy for suicide prevention as called for by the World Health Organization.
What difference would it make? I mean, we're going to get into some. There are some jurisdictions in this country doing a reasonably good job at this, at trying to fight the scourge of suicide. What difference would a national strategy and an action plan make to tying some of these things together?
Well, I mean, we can look to places that have put them in place. For example, Quebec, that has dropped the youth suicide numbers by 50%. That's staggering. Mm-hmm. What we're missing in terms of the federal level, one good example in terms of even the statistics and knowing where the elevated risk factors in the elevated areas where we see high rates of death. If I say to you 4,000 people died in car accidents last year, you would say, well, clearly people should drive safer. But if many of those deaths were happening on the same highway in the same intersections, we would say, what's wrong? And this is the kind of data that we need year in, year out, so we can start to identify there are areas of elevated risk. There are reasons for elevated risk. Once we start to identify that, then we can start to say, okay, what are the resources? So part of the strategy is actually to compel the federal government to do a number of steps and to report back yearly so that health organizations, Indigenous communities, cultural groups can start to see, okay, now we understand the patterns, we can now start to put the resources in place.
To some people, Mr. Hicks, it might seem like a daunting task to try and develop this national action plan to prevent suicide, but it sounds like from what I heard from your news conference this morning, some of these pieces are in place. Is this a starting at square one process, or are we enough down the road that it only makes sense now to go to this next step?
Absolutely. In country after country, suicide prevention is about mental health work, but it's also about a lot more than mental health work. So training of doctors, nurses, teachers, social workers to better recognize signs of suicidal behavior, anti-stigma work, targeted research, different forms of education. Quebec didn't invent anything new when they lowered their overall suicide rate by 30% and their youth rate by 50%. They did the known basket of things really well. And when you go around, you go to international suicide prevention gatherings, people talk about Quebec as an example of best practice.
Right. I guess what I'm getting at here is when people think of this will seem like to a lot of people watching, this is just a no-brainer. So let's have a national plan. But in the conversation, it can be made to sound like a lot of heavy lifting, and it takes time to do this. And so I guess my question is, are there things already in place that can be traveled fairly easily into a national plan that works for everybody?
Well, I mean, clearly one of the obvious choices right now is that we see that in Nunavut, ITK and Jack had a big role to play with that, with the communities there, of establishing a suicide action plan in Nunavut that is being funded by the federal government in this budget. So if it's being funded in Nunavut for the Inuit communities, and yet we don't have anything for other Indigenous communities. That's an obvious gap. In my region, Treaty 9, where we have some of the highest youth suicide rates in the world, we had the communities take on leadership to start a suicide inquiry, and we couldn't get a single federal or provincial partner to even come to the table. They had to do it on their own. We're talking about the deaths of children, some as young as 8. So if the federal government's willing to do it for the military, or they're willing to do it for, you know, in the far north, why don't we just take the best practices and say across the board? Because the other really important issue to understand is this is not simply an Indigenous issue, and there are many Indigenous communities with very low rates of suicide. When you look at rural, when you look at, you know, older middle-aged men, the numbers of the suicide deaths are staggering. And yet there's been no conversation about that. This is something that I think the public needs to become more aware of. There are risk factors and risk groups. New Canadians who don't know where to turn, don't know how to talk about it outside their communities. A national plan working, understanding that we have to start to identify those areas, we can start to really turn things around to the positive.
Could I just add that you can go on your computer right now and get really excellent, high-quality, detailed data on suicide in the United States, publicly available by ethnicity, by state, by county, by age, by sex. We
It's
don't
not
have
nearly
data
that
like that
detailed
in
here.
Canada.
Yeah, no.
And as Charlie says, that would allow us to focus. Hey, one interesting...
And yet in some areas, and Charlie touched on it, in some areas, and I want to get you to weigh in on that, we are doing, the government is doing work, and you touched on it on the military side. There's a lot of effort being put into dealing with it in one segment of the population, and all of that is for valid reasons. Nobody would question that. But
let's just take
again,
the same attitude.
Is that attitude portable to the wider problem?
Totally. Yeah. It's the same, the logic behind the military strategy is exactly the logic of a national civilian strategy. So it's a strange country. The federal government, both liberal and conservative historically, have, for reasons that nobody's been able to explain to me, not shown leadership. Within Canada, we have Quebec, shining star. We now have a national military program, but then we also have the Indigenous reality, and as Charlie said, large swaths of Indigenous Canada don't have high rates of suicide, but all the communities in Canada with sharply elevated rates are Indigenous. And when we started doing our work in Nunavut, there was no Canadian Centre of Expertise to draw on. So we learned from Scotland, from the US, from Australia, New Zealand. It was amazing to us how little expertise, pots of money that communities or regions can access. None of what's available in other in developed countries is available in Canada. It's just weird.
So change could come if this gets through Parliament. Charlie, what's the path forward here?
Well, we have the final hour of debate today on this. We've gotten very strong support from the Conservative caucus. I'm not sure where the Liberals are coming down. This will come to a vote next Wednesday. We have enormous support from public health organizations, grassroots activists. You know, the mental health community in this country are doing incredible things. For me, this has been a really powerful journey, and people on the ground are doing amazing, amazing work. They are doing heavy lifting in areas of some real deep damaging trauma, healing families, the bereaved families that nobody really talks to. These people are all looking to Parliament, and you know, I can say very clearly and simply, this is not a political partisan issue. Suicide cuts across every political spectrum, every economic spectrum, every demographic, every age group, and for a country as wealthy as ours not to be looking at this as a major public health concern, it's just not acceptable. So I'm looking to my colleagues in each of the parties to work with us, and I think we could make a real difference here.
Charlie, Angus, Jack Hicks, thank you both for your time. Appreciate it.
Thank you.